Hey guys, it's Matt. I'm actually in the treatment room right now, getting ready to do my 4th treatment. Just so you guys know, I know you guys can laugh, I have to wear this goofy headband because my hair is so thick and curly that it's sticking out of my face. So, this is nothing important, it's just a simple headband that they had to put on so that way they can reach the rest of my
Matt,
face.
we're going to change your treatment around a little bit today. In a beautiful way, we had about a 2-week break, completely understandable with holidays. What we're going to do is we've typically been doing a 2% salicylic acid cleansing. Now what we're going to do is jump up to a 20% salicylic acid chemical peel. Salicylic acid is fantastic in that it is called a keratolytic, so it breaks down keratin, all the things that are clogging pores, and it nicely, hold on to that, and it nicely also decreases some of the bacteria that jumps into those pores when they're clogged. It going from a 2% to a 20%, 2% is usually over the counter, or even a 1.2%. Jumping up to 20%, that's kind of a physician grade, but low strength chemical peel that we use for acne.
Okay.
You will definitely feel about 90 seconds of a little bit of a tingle, a little bit of a burn. You'll use a fan to cool everything off. If you're too uncomfortable, we can always, what we say, neutralize it with water beforehand. When that's over, we'll then go and do the isolase. The reason why is when you're taking that vacuum from the isolase, we're now going to push some of that 20% salicylic acid into it.
Okay.
Yep. So it's going to dry it out.
Okay.
It's going to break up more sebum, some more of that clogged pore.
Okay.
Whether it's new clogged pore or old. Some of those, when we did extraction just now, we had a mixture of fresh sebum, which is white and gooey, and I use the term kernels, but firm, yellow, dried areas too.
So now, will this bring more, I guess you call sebum to the pore,
yep.
or to the surface?
Absolutely,
okay.
Correct. When we do chemical peels, the things that we remind people is that you're going to stay off your medication, your topical medications that can irritate and dry you, a minimum of 3 days, sometimes out to 4 and 5 days.
Okay.
We remind you that you can be a little bit more sensitive to the sun, both from a dryness and from a redness aspect. I may decrease how strong I'm trying to go on isolase for today, as far as how high my power is. Rarely, if someone has cold sores, it can reactivate cold sores. And that's about it. It usually doesn't cause it doesn't cause scarring. It just, peeling wise, would do a little bit of the top layer.
Okay. Okay, so we're just putting Aquaphor, which is kind of a barrier to protect these areas from the chemical peel from absorbing.
What it will is sometimes it will frost or it will look a little bit white.
I can smell it.
Are you doing okay?
It's just like burning my nose, actually, more than anything.
Perfect. As long as it's not burning your skin. One is Sensual. Tolerable? How is it feeling?
It's alright.
Okay.
Actually, it's a lot easier to deal with, even with the double pulse, than the first time I was here.
So just that comfort level helps so much. Good. It's looking very, very smooth after all of our good extractions. And that lip, still staying on double pulses. Alright, we're going to switch to the left cheek, so here's that cool spray. Do you have any questions for me at all?
Not that I can think of, I mean.
So you're becoming more comfortable. Treatments are becoming more predictable.
Yep.
So in between, interval-wise, you had a little flare, and there was a concern that it was from some of the topical medications.
Yeah,
so
you're
back on just cleanser? And any sort of a lotion?
Yes, actually it was the one that you guys, I don't remember exactly what it was.
So more of just a moisturizing lotion.
Mhm.
Perfect. Nothing else medicated, correct?
No.
Okay. Because overall, I think you look much better. I think the other aspect is, I'm going to try to push some of the energies with the other one, the yellow. We'll spray the forehead. The forehead
Ready?
doesn't have as much activity, so I'm going to take it off of the double pulses, okay?
Mm-hmm.
The yellow allows us, so I'm going to change the tip again after doing this. The yellow does allow us to address a little bit more all the redness that you have. So again, that scarring, I know it's always semantics, but I always differentiate scarring, tissue scarring, where it's indented, we say atrophied, so it's thinned,
Yeah.
versus scarring that bothers people and it's just discoloration. So a true scar is a collagen change, what we say post-inflammatory pigmentation. That means you get a real red acne bump and you're left with a red spot that then becomes a red-brown spot. And the laser can't beef back up collagen.
Yeah.
There's another laser that I have that I do a lot of regrowing of collagen.
Hey guys, it's Matt. Just getting back to you now after my 4th treatment. Just going to talk to you guys quickly, just kind of to say, it's now the 4th treatment and I'm getting ready to go do my 5th one soon, and I just hopefully am going to notice some bigger changes. I am noticing that my face is clearing up. There's not as many new breakouts. There is still some new breakouts, and my face is smoothing up. So we will get back to you guys with the 5th video soon. Thanks.